Hey everyone, this is Troy with the Advanced Spine, Joint, and Wellness Center. Once again, hey, if you've been following us here on these weekly podcasts, welcome back. Hey, if you can't hear me, welcome back. Hope you've been finding the information valuable, helpful. Last week, we talked more about sciatica. We got into the piriformis a little bit as a potential cause of sciatica. And today we're going to talk about the hip as a potential source, which is a potential source of sciatica. First and foremost, as always, if you're looking for help, you live in the local area to Medina, you're 15, 20 miles from us, you need some help, you can find us at ohiopain.com. That's our website. You'll see all the goodies on there, all the different things that we do. As well, if you're looking for us on social media, hey, our favorite place right now, which is growing like a weed, is our YouTube channel. Just hop on YouTube, search Advanced Spine, Joint, and Wellness. These videos that are on Facebook Live get uploaded to YouTube. And then if you like us, subscribe to us. You'll get notified as new videos come out. I'm not the only one here putting videos out. There's also some of the other doctors who are routinely putting information out. If you're just looking for information, check us out at YouTube. You can find us on Facebook, and you can just search at advancedmedina.com or just Advanced Medina. Sorry about that. And then on Instagram, you can go to advanced_spine. So let's get into today's topic. We've been talking about sciatica. We've been running through these models, discussing the different potential sources of sciatica. And today, we're going to talk a lot about what patients will describe as their hip causing sciatica. We hear this a lot. They go, it's my hip, it's my hip. And the hip is a difficult one. We see a lot of patients who get stuck. They go see a back doctor, and they have sciatica or pain in their lower back, into the glute, into the leg or hamstring. Then the back doctor says, I don't think this is your back. Go see a hip doctor. So then they go see the hip doctor. They get MRIs, they get CTs, get x-rays of the hip, and the hip doctor goes, it's not your hip, it's your back. Now, it's funny. We saw a patient who had bounced from 4 different back doctors and 3 different hip doctors. Saw one back doctor, said, hey, go check out a hip doctor. That hip doctor said, no, it's your back. So she got a second opinion from a back doctor. That doctor said, no, it's your hip. So she saw another hip, and it just went back and forth. She saw 7 different doctors, and each one gave her different things, and really no resolution of the symptoms, unfortunately. So she was really frustrated. But in that regards as well, for the doctors, sometimes this is really hard for us to tease apart hip versus back and sciatica. So let's talk about it. So symptoms first and foremost that a lot of patients experience when it's the hip. So a lot of folks will feel pain in a couple different areas when it's the hip, and this is where it can be confounding. First and foremost, a lot of patients will reach back to this area and say, my hip hurts. Yeah, that's definitely some. A lot of patients will say, hey, it comes into my butt right here, my hip right here, and down my leg right in this area. Yeah, that's common. Into the thigh, and then also, this is where it gets difficult, into the groin. So we commonly see groin pain along with. Now, not always. So those are some of the symptom areas that we can see. Pain, shooting pain, numbness, burning, sharp pain, achy, numbness, tingling, all of the above in some cases. The symptoms can be worse with sitting, going from a sitting to a standing position, initially going from a sitting to a standing position and walking, and oftentimes with these problems, sometimes they get better with activity as you start moving, but then if the activity is too long, then we see symptoms creep back in. Night pain tends to be pretty common with our hip sources of sciatica. Night pain is very common, trying to sleep on your side, your back, your belly, you just can't find a comfortable position. Many patients find themselves in a recliner as the most comfortable position to sleep. It's just really common. They just get frustrated and they're like, that's it. So they run to the recliner, off they go, they're sitting in the recliner trying to sleep. So those are some of our symptoms. Now we can also get radiating pain all the way down from the hip, all the way down the leg into the foot. Now the reason being, let's review some anatomy again. I know we do lots of anatomy reviews together, but it's important so you understand what's going on here, especially if you're one of these people that's stuck and you're just wondering, what in the world do I do here? So again, if we look at the spine, here we are. This is someone looking straight towards us, okay? Here's the sciatic nerve. It's made up of these 3 nerves once again, like we talked about the weeks before. It comes down, forms a common nerve, goes past the SI joint, which we talked about. We're going to talk about this one again in a few weeks because this was a big topic. A lot of folks had interest in this one. Runs through this little notch, comes out the rear end in the piriformis, And then last but not least, it goes right by this little joint right here, and that's the hip joint. So here's our hip joint, and the sciatic nerve is running right behind it. So the hip joint is located here. And one of the big things that we see with the hip joint that contributes to sciatica is arthritis. And oftentimes this guy's flying under the radar. And it's arthritis in the hip that can sometimes be the source of the sciatica. So it's a difficult one to sort out, because if you look at where the hip is, if we look at it here, it'll oftentimes cause that groin pain because it is located deep down here in the groin. But it also causes pain on the side of the hip. There's a bursa over here, cause pain through this area. But it's also located right here in the rear end. So when people sit, they get this pain right here in the rear end, and that can be the hip joint. But this hip joint also works with the SI joint, and that's where a lot of people feel, quote unquote, their hip here in the back area. So hip arthritis, quite frankly, is a really common one that we see with failed back surgeries, where someone goes, gosh, I've got sciatica, and we all look at the back. Of course, it's the most common place to look. People have shooting pains going down their legs. They go and have some surgery, maybe a microdiscectomy, a framenotomy, laminectomy, or God forbid a fusion, and afterwards we're still having some persistent pain, only to find out we have a bad hip. That's an extremely common story. Also, hip pain can also masquerade as knee pain. So sometimes it causes pain in the knee, and we're looking at the knee going, gosh, the knee looks fine, but I'm still having pain. We place the knee, or maybe we get the knee scoped or have some cortisone injections, doesn't work. Lo and behold, it's the hip referring pain down to the knee as well. So hip arthritis is a very, very stubborn one, and sometimes it's very straightforward, just causes classically groin pain, but other times it can cause radiating discomfort. So our treatment options for these guys become many when it comes to hip arthritis to help with the sciatica. Number one, the first thing we have to do is establish a diagnosis, and we also want to make sure that we look at this appropriately, kind of like gears in a watch. Oftentimes, if one gear goes, it's going to set off others, and that's where we want a really good exam. If the hip becomes dysfunctional and the hip isn't moving properly, well, all these muscles and soft tissues that work through, that attach through here, are likely going to be dysfunctional, and so will the SI joint, which then can cause dysfunction further up the chain. These guys are just like gears in a watch. Gear 1 is here. Gear 2 is muscles. Gear 3 is the SI joint. Gear 4 is the spine. We throw off one area, and it's likely we throw off others. So first, we need a good detailed exam. We need some imaging studies. We need to really figure out exactly where the symptoms are coming from. If it's the hip and it's arthritis, we get 4 choices. Okay, so we get 4 choices on dealing with these things. Option 1, oftentimes, if the hip arthritis is early, we can get these to respond to just home-based treatments. And there's a plethora of things that we can teach you at home, whether it's home-based stretching, home-based over-the-counter oral anti-inflammatories, herbal anti-inflammatories, etc. Number 2 is prescriptive medicine. Sometimes these will respond. I had a young lady today who responded to a great arthritis medicine, and her hip had mild arthritis, and she responded to a prescriptive medicine called meloxicam or Mobic, and it was terrific. A great way to get her to respond. And there's many other medicines. Some people can't take those medicines. They're not really designed to be taken too long term, but they can really help in the short term. Third thing you can do is there are injectables for the hip, whether it's a corticosteroid or a steroid. Those can help. Hyaluronic acid injections. Alpha-2 macroglobulin. We're talking about this guy next week because this is going to dovetail into this regenerative medicine field. So alpha-2 macroglobulin, we draw blood from you, take it, spin it in a centrifuge, dehydrate this plasma, and find this little chemical that your own body makes that we can inject into the hip, and it can be very helpful. PRP, platelet-rich plasma, can be injected into the hip. That can be very beneficial as well to reduce some of the pain and inflammation. Rehabilitation can be very helpful when done appropriately and when we're focused on the right problem. Oftentimes we see hip arthritis fail physical therapy because we haven't really established a diagnosis. We're just treating sciatica or the radiating pain, but we don't really know where it's coming from. And this is where if you failed physical therapy and you didn't have a diagnosis, of course, we don't know what we're treating. So we first need that diagnosis before we just launch you into therapy. It always drives me crazy when people get launched into therapy with no diagnosis. It's like throwing mud against the wall and just seeing, what's going to stick. What can we do to help you? It's silly. So we need a good diagnosis first. Chiropractic care can be beneficial. Robotic laser therapy, we do that here as well, which is a great non-surgical treatment that can reduce pain and inflammation. And then ultimately, hip replacements can be done. And those are really all of our options for this. But sciatica is a difficult one to nail down the diagnosis. It's so easy to pigeonhole sciatica as always coming from the spine. And this is where we see a lot of folks just unfortunately stuck, frustrated, and unhappy because we all just get x-rays or MRI scans. We treat those images and we only treat the images. Some patients have never even had a physical exam. I hear that too often. It's unbelievably frustrating that some of the doctors out there, really, we aren't putting our hands on people. Are you kidding me? I don't know why, but we hear it too often that we look at people and people go, gosh, that's the best someone's looked at me. I just heard that from a patient who was in a car accident in Florida, seeing a doctor down there for the past month. He's here on vacation and took a look at him yesterday. He goes, gosh, no one looked at me like that before. I don't understand why, but it happens. You need a good exam. It really is the first thing. So thanks for tuning in. Next week, we are going to talk about this thing called alpha-2 macroglobulin. Alpha-2 macroglobulin is what's called a protease inhibitor. We're going to talk about that in detail. And it is a regenerative medicine procedure that is FDA approved and has been so for the past 4 years, and fantastic. Hey, if you like our videos, again, go to YouTube, search for us, find Advanced Spine Joint Wellness, like, subscribe, comment, leave questions. If you're looking for help, go to ohiopain.com, reach out to us. Julia is always available at this phone number that's on the screen, 330-242-7669. You can text her with questions. You can comment here. We'll answer your questions. And again, if you're looking for us on Facebook, Advanced Medina. And then if you go to Instagram, Advanced_Spine. Folks, have a great week. Hope you had a great 4th of July. Next week, we will be talking about alpha-2 macroglobulin. We look forward to it. Have a terrific weekend.